A concentration of despair.
I started using heroin when I couldn't get the pain pills anymore.
Deplorable conditions.
I was staying in the tent. It was better than a shelter.
Corridors of crime.
Fights, stabbings, gunshots, people stealing from people, a lot of ODs, a lot of drug dealing, you know what I mean?
By January 2022, the intersection of Massachusetts Avenue and Melnia Cass Boulevard in Boston had become the epicenter of a drug and homelessness crisis. While the area, now known as Mass and Cass, has long been home to drug treatment services and transient people, problems worsened in 2014 when the city of Boston's homeless shelter on Long Island closed. As the opioid epidemic grew, conditions worsened, and by 2021, entire city blocks had been taken over by tents, a humanitarian and public health crisis.
I was out there.
Danny Davis had experienced homelessness for more than a decade.
I was just finding cardboard and stacking it up, getting blankets and making a makeshift bed. The street life was nothing but negativity.
In January 2022, newly elected Mayor Michelle Wu met a self-imposed deadline to clear the encampment. She promised the urgent action wouldn't compromise compassionate care for people with substance use disorders.
I want to be clear that we did not solve homelessness yesterday.
According to the Boston Public Health Commission, 179 people have been moved to transitional housing from the Mass and Cass encampment, including to the Roundhouse Hotel and a cottage community on the grounds of the Shattuck Hospital in Jamaica Plain. Both facilities are considered low-threshold housing, where sobriety is not a requirement.
If I didn't come here, I would be dead. I would have been gone already.
Danny Davis says his road to drug use and homelessness is rooted in childhood trauma.
Things that I resent, personal issues, like my father doing life in prison. I have a lot of built up anger towards him.
Davis says he's taken steps to recovery and treatment while taking shelter at the cottages. The community was established through a partnership among the state, the city of Boston, and the Commonwealth Care Alliance, the nonprofit healthcare company that runs it.
This is the first of its kind on the East Coast. These are essentially mini homes for people that are fully self-contained. They're lockable. They have their own heat, and people can come on this site and get all the healthcare and mental health services that they need.
I made the choice to come here because I want a life for myself. I come from negativity. I come from a family of drug use, and it's like I'm trying to stop that cycle.
Israel Montez lost his tent in January.
I've been in the streets for at least 15 years now.
Like Davis, Montez says the cottage community has helped him regain his life after his time on Mass and Cass.
Not much, but it's something. It's better to beat the streets than to beat the cold, man. It means a lot, I owe it back to the community, I owe it back to my family, but I really owe it to myself, man, because I come a long way, and I'm gonna do it.
We are meeting people where they're at, whatever support we can give them. There have been multiple residents here that have engaged in medicated assistant treatment once they've gotten here. And truly, that's all about the relationships that they're developing with the staff, with the recovery coaches.
COVID-19 limited access to treatment services. As the pandemic surged, so did overdose deaths in the city. Opioid-related deaths increased from 173 in 2019 to 248 in 2020. Despite best efforts, a woman living at the Roundhouse Hotel died in February as a result of an overdose.
Substance use disorder, it's a chronic and deadly disease. And it takes, over 100 individuals across the U.S. every day.
Bill Lim, who owns a Sunoco station in the area, says while the tents are gone, treatment services and housing are still concentrated too closely to the illicit activity that persists in the area.
The addicts are using drugs and they need the money to support the habit, stop the drug activity, and maybe getting help not from this environment. There's somewhere else that they can succeed.
Dr. Monica Burrell, senior advisor to the mayor for the Mass and Cass crisis, says the city is committed to finding long-term solutions.
We are providing those individuals with outreach and offers for support and treatment every day. This is just the beginning.
Danny Davis encourages others to look past the optics of Atkinson Street. He views the crowd as a community in need of compassion.
I think they should continue to give resources and services like this. A place like this can end homelessness for a lot of people, man. Don't judge a book by its cover because, like, you got some amazing people down there.
And an update to share, Danny Davis has found permanent housing. He's participating in a work program. He's continuing on with his treatment, and he says he's very excited about this next chapter for himself.
Yeah, it's a little unclear how long the cottages and the services at the Shattuck Hospital will remain on that site. But even before they were set up, the Baker administration was talking about having long-term services and solutions at that site. So there may be a long-term option there.